wear gowns if you want to, because if there's a chance that you could get blood or body fluid on you, you know, you could wear a gown, right? So you could choose to wear a gown, you could choose not to wear a gown. You know your patients after a while, how much coughing they're going to do, and therefore you'll determine whether you want to wear a gown or not.
Let's get you some masks with shields also.
Testing, are we wearing gowns?
You don't have to. No, you
No?
don't have to.
Okay.
I think I know what the shields look like.
Oh, they know.
Professor, and if you're on a floor that you're getting new patients all the time, and you're not used to seeing your same patient, you're gonna always wear a gown then, because you don't know?
No, I know based on how much secretion the patient's putting out. So then I determine whether I would wear a gown or not. Most of the time, you'll see the nurses don't wear gowns. But, you know, until you get used, if you think you can be so close that you can get splatter, yeah, you could wear gowns. Okay, you need masks. Before I put the mask on, let's talk about what you're going to need to do. You need to do a setup before you get started. You need to set up your suction. You need to set up your oxygen. So let's set up our suction. Y'all remember this?
Thanks for all plastic.
And remember, these are all new setups, right? So the first time you set up, there's this clean setup. And then after that, when you go to use it, you could see that you'll need to wear gloves, right? Because somebody else already used it. Just talking about in the hospital. But for us, this is our setup.
Professor, right now for us, this is on off, right?
Hmm?
This is on off, or you have it
Oh,
on?
yeah, it all. That's your continuous. Okay?
Oh, no, it's working.
Yeah, it works. I don't know what's wrong with it. Probably it would have worked by day too. Okay. Then the next thing I need to do is set up my oxygen. And with this oxygen, you need to use an ambu bag, okay? The ambu bag is going to fit this piece of the ambu bag. This one you're going to use only, not for the trach, but for the mouth. Like if you need to bag the patient before they intubate the patient or something, this is what you're going to use. For us, we're not going to use this now because I'm not going to teach you that. I'm going to teach you how to use the regular ambu bag. When you come out, remember, this is your
Barometer.
flow meter, right? And then you have the Christmas tree at the end. If it's not on, you just attach your Christmas tree, okay? Green into green. Okay. You set up everything first.
You already introduced yourself and everything.
Yeah.
The patient.
The whole shebang.
And wash your hands.
Question, in the hospital, don't they have respiratory therapists to do some of this work, or are we doing it?
Yeah. You have respiratory therapists. The respiratory therapist is going to come to do, to give you the supplies. But they're not there around the clock. So if your patient has secretions, you are responsible for suctioning the patient. So that's why you need to know how to do it. Because yes, this is something that respiratory would do for you, but it's also something that you have to do when respiratory is not there.
Right.
Do you get it?
Yes.
All right. So here is your ambu bag. This is the reservoir, and this is what you're going to attach to the patient. Okay. So let's turn it over.
How many?
Just until the bag gets full. Okay. So when you ambu bag the patient and you ambu bag, you could see you suck in the oxygen in and it's getting to the patient. Okay? So here we have that set up.
Dr. Hannah, how much oxygen do you need to turn it up all the way?
I turn it all the way.
Oh, okay.
And you're just gonna leave it on like that for now, right?
For now to show you. But when you're not using it, you're going to shut it off because there's oxygen we're wasting. Okay? All right, so we have that set up. Usually for these patients, they're not laying flat, right?
Right.
So you have two things. This one has one glove or a pair? I don't remember. I think two gloves, okay. Some catheters only have one glove in it, okay? That glove is gonna go on your dominant hand because that's the one that you're gonna use to guide it into the tray. The other one could be non-sterile glove, but these packages have two gloves in it. So one is gonna be a sterile glove and one is gonna be non-sterile. That's how you're gonna work as if it is. Okay, but you know the two are sterile gloves to begin with. And then in it, it also have the catheter that you're gonna use to suction the patient with, and it has a little cup. And that cup is what you're gonna use to put the saline in. Because you need the saline to kind of lubricate the tube and to also clear the tube. Okay? In here is your trachea kit. And so what you're going to do, you're going to suction the patient, you're going to do the setup, you're going to suction the patient, and then you're going to take care of the trach. Now, many years ago, we used to do 1 part hydrogen peroxide, 1 part water, but saline. But now your new book talks about just using saline to clean the inner cannula. Okay? So just let me show you what the inner cannula looks like even before we get started. Okay? And I notice all of a sudden I'm like all this okay. That's my new word, okay?
You understand? Okay,
Yeah.
good.
Let's make this clear.
Yeah.
Ordinarily, a patient ain't gonna be this flat, right? So let's sit them up a little. Bless you.
Thank you.
Like how much, 30?
Enough for you to work with.
To work with, how much would you usually have them?
How about this? Except if it's distress, then you know they need to be
It's like
high
45,
fouls and
right?
45 degrees or what have you. I just want to fix your head for you, okay? This here has an inner cannula, and this is what the inner cannula looks like. If you notice, you can pinch the edges here, and it's going to release it. This is like snapped onto the inner piece, okay? So here we go. You snap this together, and then you ease it out. And this comes out. This is the inner cannula that gets blocked and kill your patient. Okay? So this is why you need to take this out, and there's a brush in the kit, and you're going to sit this in the saline, and you're going to brush that and take all that mucus and stuff that gets hard in here. And this is why you can't wait for the respiratory therapist all the time, because if the respiratory therapist comes every 2 hours, every 3 hours, you could see if you have a lot of secretion sitting in here that it could get hard and block this tube. And that isn't what you want.
So it's every 2 to 3 hours you're going to
You want to suction the patient. Depends on if the patient, some patients could cough and clear their own secretion. It's just that they have a trach. Some persons can cough and clear that secretions, and they need you to clear it for them. And you will hear, remember we did health assessment last semester, and we know how to listen for breath sounds, and we know how to listen and know when our patient is congested. So that's what you're going to do. So this is your inner cannula. So let's put it back in until we're ready to get started.
What if the patient takes it off?
Then you put it back.
But like, what if he just takes it off and like?
Take what, the inner cannula
Yeah,
out?
and like, let's say you were like with other patients and you come back and then.
This
oh,
shouldn't
it's
come
just-
off that easy because see this locks in there.
What if he knows?
Can I look at that?
Put it back on.
Look at that thing, how's
He knows that he doesn't want to take it out.
That's right. He knows that if he takes it out, he can't breathe and he's gonna die.
Yeah.
So then how, okay, exactly my point. So then when you take it out and you have to clean it.
Then
what
you're gonna put the
happens?
ambibag. Remember we set this ambibag up, so I'm gonna give him sit it here, let a little bit of oxygen go on it. And half the time, if the patient really needs this for oxygen, they usually have like the a trach collar on. A trach collar has like it's connected to the oxygen, and it like sits over it like hair, and so oxygen keeps flowing in it. Okay? And that's what I'd sit there while I'm cleaning it.
Wouldn't it be easier if you had like replacement
Yeah.
catheters instead of
We
having
always
to
have a
clean it?
replacement at the
Sounds more
bedside
dirty.
for an emergency.
Oh.
Because if this get blocked, you want to take it out. Say the whole thing gets blocked up. And in an emergency situation, you need to take this out. If you don't get something in there right away, once the
Yeah,
whole
the
thing
hole
comes out, the hole will
close.
close. So you always have a forceps at the bedside, and you have the same tray kit that the patient has in. An extra one at the bedside. Okay? But a lot of times we have these replacements there, so you'll take this out and you'll just put in another one and throw this
Right.
away.
That sounds
Yeah.
more
But
cleaner.
it's more cleaner, but it's also more expensive. You know, in Cuba, we're going to keep using these.
We're gonna clean that.
Okay, you see how to put it back in? So you just pull it out like this. Remember, when you're pulling it out, you have to hold this so that it doesn't come, the whole thing don't come out of your patient. Okay? Because the whole thing come out of your patient, you in deep trouble. Okay? Deep, deep trouble. So hold it in place when you put it in, when you're taking it out. So here you go. You just slide it back in.
We don't
And
say
then you
anything
lock
to
it in.
him, like, oh, hold your breath, nothing.
No,
It's
you
not
just
back in?
tell him. You just talk to him and tell him what you're doing.
It just snaps back in.
Yeah, it snaps back in. See, it just snaps back in.
Snap back. Snap back
Okay.
straight.
All right, so that's just to show you the whole setup before we get started. Now we're ready. So I'm gonna open everything that I need so that I get everything in order. You know, the usual, just don't imagine that I just did this, I washed my hands, I just showed you that. But imagine that I just went, I washed my hands and everything, and now I've gathered my supplies and I'm back. I have those, I have,
Okay, so first, you connected everything.
no, you're gonna come in, hello, my name is Stephanie, I'm gonna be your nurse today. What's your name? Let me check your ID. I'm here to give you trach care. Is that okay with you? And more than likely he's gonna nod his head because he can't speak. And then you said, okay, I'm gonna go wash my hands and gather my supplies. You go out, you wash your hands, then you walk over here to the table and you're gonna pick up the whole setup for the suction, which is the cannula and the regulator. You're gonna pick up an ambu bag and you're gonna pick up the flow meter. You're gonna get your suction kit and you're gonna get your trach kit and you're gonna get some saline. You're gonna pick up this saline. Okay? Sodium chloride. Okay, do your usual, check your expiration, make sure it didn't expire. And you have everything now. You come back to the patient, knock, knock, can I come in? Yes, I'm here.